Namaste. Yoga is a multifaceted system which offers a solution to a lot of our physical, mental, emotional and of course spiritual problems. So today we are going to talk about such a problem which relates to our physical body, and we will try to find out some yogic intervention into that problem. That problem is commonly known as the Piriformis syndrome, and it is related with the most important piriformis muscle, which is located at the back side of our pelvic region, just nearby the hip joint. Piriformis syndrome is usually characterized by a severe pain starting at the backside of your buttock and ranging down to the backside of your leg. The pain can manifest in various forms, and usually it's very difficult to diagnose that the actual cause lies where. But after proper diagnosis, if it is ensured that the pain is coming from the inflammation in the piriformis muscle, then we can use certain asanas, certain yoga asanas as a therapy for reducing the inflammation from the piriformis muscle. In the next section, I am going to demonstrate you which are those asanas and how to use them to get rid of the pain and the inflammation in the piriformis syndrome. So, piriformis muscle is a very important external rotator of the hip joint, and to counter its inflammation, we have to focus upon the internal rotation of the hip joint, because the major cause of piriformis syndrome is a spasm which occurs on the surface of the piriformis muscle, or it gets tensed and tight. And when it gets tensed and tight, when it is under spasm, it starts pinching on the sciatica nerve, which passes just under the piriformis muscle, and as a result of that pinching, the pain radiates throughout the leg. So what we will focus upon with these asanas is internal rotation and a very gentle stretch of that muscle. We will start with Vajrasana. I am going to demonstrate these asanas in a sequence so that you can remember the sequence and gradually practice it. You can also do it in case of the acute pain. If you are experiencing a pain in the hip area due to the sciatic nerve pinching, then also you can use these asanas to get rid of the pain. And along with that, in the long course of time, these asanas will help you to remove or to get rid of the inflammation in the muscle. So we start with Vajrasana. We'll spend a few seconds in Vajrasana with your spine upright. From Vajrasana, we will go into Gomukhasana, putting your weight onto your hands, bringing the legs in a crisscross position. The opposite arm will go up, bend over in the elbow and grab on the other hand behind your back. Please make sure that the spine is erect, and as you can see, the hip joint on top is in an internally rotated position. Now coming out of Gomukhasana, we'll go up into a standing position from here, and we'll move into Parivritta Trikonasana. Exhaling, go down, and the other arm goes up. Now again you can see this hip joint is internally rotated and is in a state of a very gentle stretch. Coming out of the posture, stepping into Samasthiti, we'll go into Garudasana. For Garudasana, revolve one leg around the other, just hold it into an internally locked position. As you can see, this leg is internally rotated, and then crisscross your arms if you can, otherwise just hold them in a namaskar position in front of your face. Then coming out of the asana, going back into a wide leg position, again into Parivarta Trikonasana. I'll show you from the front how it looks like. Then coming out, going into Gomukhasana, revolving the legs, sitting down and performing one more time Gomukhasana. And then going back into Vajrasana. Gently putting the weight of your body on your hands and crossing the legs. Bringing the heels outside so that you can see the hip joint is an internally rotated position. You can make up this sequence as per your own comfort on both the sides or on one side, whichever side is in pain. This is your freedom, you can design it and keep doing it. This sequence is definitely going to help you to get rid of this problem. Thank you very much. Namaste.